This episode is brought to you by the Fertility Awareness Mastery Charting Workbook, the first beautifully designed, fully customizable paper charting workbook designed with you in mind. With 3 years worth of charting pages, the Fertility Awareness Mastery Charting Workbook has you covered. If you've been looking for a solid alternative to charting apps, you'll love this charting workbook. The FAM Charting Workbook is available in both Fahrenheit and Celsius editions and is available in spiral-bound, paperback, and ebook versions. Head over to fertilityfriday.com/workbook to order your copy today. That's fertilityfriday.com/workbook. This is the Fertility Friday podcast, episode number 474. Welcome to the Fertility Friday podcast, your source for information about the fertility awareness method and all things fertility. I'm your host, Lisa Hendrickson-Jack. I'm the author of The Fifth Vital Sign and the Fertility Awareness Mastery Charting Workbook. I'm a certified fertility awareness educator and holistic reproductive health practitioner with over 20 years of experience teaching women to connect to their fifth vital sign through menstrual cycle charting, balancing hormone health, and optimizing the menstrual cycle without hormones. I have been consistently outspoken about hormonal birth control over the past 2 decades and its impact on fertility and overall health because you have the right to know how your body works and how artificial hormones disrupt that natural process. I teach women's health professionals how to utilize the menstrual cycle as a vital sign in their practices, and I host live coaching programs to help you achieve optimal fertility and health because it's important to have healthy menstrual cycles regardless of whether or not you want to have babies. I'm also a wife and mother of 2 beautiful boys and a brand new baby girl. This podcast is designed to empower you to take full control of your cycles, your fertility, and your overall health. And I'm so excited that you're here with me today. Today's episode is all about thyroid. And what I really appreciate about today's interview is that we get into some different topics. We get into the topic of cellular hyperthyroidism or tissue hyperthyroidism, which is a really interesting concept because it strays away from the idea that the sole issue with having low thyroid function is related to your thyroid's inability to produce thyroid hormone and explores the role that peripheral conversion, to be jargony for a second here, conversion of thyroid hormone has on the topic. And so, briefly what that means is that sometimes the issue isn't just that you're not making enough thyroid hormone. Sometimes the issue is that your body is stressed, undernourished, micronutrient deficient, whatever's going on, to the point that you're not able to convert the thyroid hormone that you have into the usable form. And this is what comes into play for a whole lot of people with subclinical thyroid issues, meaning that it's not necessarily overt to the point that your medical doctor is going to do anything about it based on your test results. It would be potentially outside of the functional range, but it's not necessarily enough to alert anyone in the traditional medical system, but you yourself don't necessarily feel well. So, it's obviously a lot more complex than that, but I just thought this was an interesting way to start today's episode because I find this topic to be extremely important, extremely useful, and it is really helpful to broaden the way that we're looking at thyroid issues. So I'm just going to share a little bit about today's guest, Dr. Eric Balcavage. He's been on the show before. He's the owner and founder of Rejuvigen, a functional and regenerative medical clinic in Glen Millis, PA. He is a certified nutrition specialist, a certified functional medicine practitioner, board certified in integrative medicine, along with being a licensed chiropractor in Pennsylvania. He is the co-host of the Thyroid Answers podcast, a podcast that focuses on answering your most pressing questions about chronic hypothyroid symptoms that you're just not getting in other places. And he has made it his mission to change the way medicine looks at hypothyroidism. He also recently released his new book, The Thyroid Debacle, which we will get into shortly. Dr. Balcavage is joined today on the podcast with his co-author, Dr. Kelly Halderman. She has a background in functional medicine, earning her medical doctorate, MD, in 2007, and completing family practice medicine with the University of Minnesota in 2009. She is an international educator in the area of integrative and precision health. She also has a traditional naturopathic medical degree, and she holds a certification in methyl genetic nutrition by the Nutrigenic Research Institute and has a certification from the American Functional Neurology Institute in Functional Neurology and Neurofeedback. Dr. Halderman also has a doctorate in clinical nutrition. She is a former physician turned executive level biotech expert. And in today's show, we are going to get into thyroid function, why so many women in particular are struggling to get answers and proper support, and some really practical tips to address this issue. So without further ado, let's go ahead and jump into today's episode. And I'm really excited to be here with Dr. Eric Balcavage and Dr. Kelly Halderman. This is the second time I've had you on the show, Eric. So really excited to talk about your new book, The Thyroid Debacle. I think a great place to start, because as I was mentioning to you, it's been a little while since I've had a show specifically about thyroid. Maybe it would be good just to give us, I guess, the kind of basic rundown of the thyroid. And specifically, I guess you could just think about it in terms of how important optimal thyroid health is for female fertility. I feel like that would be a great place to start.
So essentially, you have this gland, this butterfly-shaped gland right in the middle of your neck, right, that produces primarily something called T4, which is the primary circulating prohormone to help drive metabolism. And we say prohormone because it's not quite ready for prime time. But what happens with that thyroid hormone T4 is it gets brought into cells, gets converted into T3, and T3 is the active hormone, the primary active hormone that drives metabolism in the body. And thyroid hormone helps us create energy. It helps us burn fat. It helps us turn food energy into cellular energy. It helps us make hormones and neurotransmitters and healthy skin, healthy hair, all these wonderful things that we consider associated with health and well-being, including being able to get pregnant. Thyroid hormone plays a critical role in your ability to maintain an appropriate menstrual cycle, to make your sex hormones, to regulate your sex hormones, to put your pelvic area in a position to host a pregnancy. It has a big role in ovarian function. So every aspect of fertility, thyroid hormone plays a role. So it's critical. Now, I think the big challenge is that we consider that we're either hypothyroid, our gland either makes enough hormone or it doesn't, or we're hyperthyroid and our gland makes too much hormone or it doesn't. And what Kelly and I have talked about in the book is that this has been the dogma for so long, and yet people struggle with chronic hypothyroid signs and symptoms, and sometimes hyperthyroid signs and symptoms, despite being told that they have a gland that works just perfectly. And the assumption is, as long as two markers that we use to assess thyroid gland function are within the normal lab range, that the overall physiology is fine. And there's been enough clinical data and there's been enough anecdotal data to show that people can have chronic hypothyroid signs and symptoms despite having a gland that works what we might consider optimally, or considering that the gland is not diseased enough that it needs treatment. And in a world where we have people struggling with fertility, people struggling with blood sugar issues and obesity and all these chronic immune inflammatory conditions, is not often a question of does a person have thyroid hormone dysregulation. It is what tissues is it impacting and what's the best way to address it.
Mm-hmm. I feel like that brings us back to the title of your book, The Thyroid Debacle. Mm-hmm. I love that. Although I don't love the fact that it is a debacle, and so many women and, anyone really with thyroid issues, how hard it is to get answers and to get support. So maybe share with us, Dr. Kelly, you could maybe take this one on. Tell us about why you called it the thyroid debacle. I think, Eric, you got into some of what that debacle actually is, but share with us why it's so hard for people to get proper diagnosis and adequate support with thyroid. I'm imagining that this has a big part of why you called it the thyroid debacle.
Yeah, I'm the perfect person to answer that question because I was trained in the medical field. I was trained as an allopathic physician in family medicine. And so I understand what it's like to be the doctor who is handed a set of tools that's antiquated, but yet you have to use these tools. You have to play by the rules because that's what the rules say. And so when Eric asked me to help come in and write about my experience, write about the experience of the doctor and why they only test your TSH and why they only will, if that's elevated, they'll go look at one more lab. And we know we have 200 and almost 50 references in our book that says that that's a debacle right there. That, this is not our opinion. I always say this on podcasts is that this is not Dr. Eric's opinion. This is him going into the research and I helped a little to really pull out that there's more to this situation than what we're doing in the allopathic model, which I don't practice anymore. But again, I'm the person who can come in and say, I would look at women in the face and their hair's falling out and they're overweight and their skin's dry. They have every symptom of hypothyroidism. And I would look at their labs and their TSH was fine. And I'd look them in the eye and I'd say, you're fine. Must be in your head. That's what I was taught. That's what we were taught. And it's, again, Eric can go into all the biochemical pathways and that's his forte. He's a genius at this. But really, we are looking at when you go into your traditional allopathic office, it's not your doctor's fault at all. It's just the training. And so this book is for physicians and doctors and practitioners alike because we want to build bridges. We want to say, we understand. I understood when I was practicing in that model, something was wrong with this model. People were ill, but the labs weren't looking like they were ill. And so we were treating the paper instead of the patient. But again, it's really no surprise with the number of people who are even on thyroid medication, who have Hashimoto's, who have hypothyroidism, the unsatisfaction that they have with the care they're receiving. That speaks for itself. So the thyroid debacle, it's not something we made up. We just coined the term because of what we're seeing.
I am so glad that you said that. I mean, one of the challenges, even with the work that I do, I'm teaching women how to understand their menstrual cycle and charting. And so a lot of women, they get into it and they start to see, oh, wow, like what I eat and what I do, it has an effect on my hormones and et cetera. And then they want to take the chart to the doctor, be like, look, this is so interesting. And the doctor is kind of like, what is this? Like, get out of my office. So what you said is that this is a result of their training. This is not their fault. We can't go into the doctor's office and yell at them because this is how they're treating us, because this is literally how they're trained to do this. And you said you want to build bridges. And I feel like that is so important when it comes to this concept of, functional medicine versus allopathic medicine, so that we can just try to understand. Everyone put the pitchforks down. Let's try to understand where your doctor's coming from and why it's not working, why it's not helping you, so that we can actually move forward. So I think this is a good time to then let's go into it. What is the allopathic way of dealing with thyroid? Why does it fall short? And how do we start actually getting answers and getting support? Whoever would like to take that one.
I'll just start and Eric can fill in all the things that I usually miss. But I did train in this model. Eric knows this model very, very well. It's very brief. There's a lot of different screening tools or screening, what would you say, Eric, more of a criteria that where some people will get screened. And so it depends on which that your doctor is actually following. But some of the certification and some of the governing bodies say that if you have a relative who has hypothyroidism or an autoimmune condition, then you get screened. Or if you hit this age, you should get screened for possible hypothyroidism. Or if you have these symptoms, then you automatically get screened, no matter your age or anything like that. So that would mean that you're going to go in and get blood drawn and you're going to get a TSH, thyroid stimulating hormone, right? So you're going to get that test. And then if that is above the limit, above that normal limit, which we can go into how those normal limits just seem to get higher, or, they seem to get wider as our population gets sicker. But if that's elevated, then you'll get what's called a reflex free T4, meaning how much T4 is running around in your blood. And so if it's low, then typically you'll get put on a prescription such as Synthroid. That's kind of your typical T4 replacement. You'll be told to come back in a couple months to monitor again your labs. I was more interested in labs when I was practicing allopathic medicine than really against symptoms, because we just tended to just look more at the paper than the person. But we're trying to find a good dose for the person. We're trying to find that sweet spot. Some people get that honeymoon period where they feel great and they're like, wow, my doctor just fixed all my problems. All I needed was just some T4 in my blood and now I'm good. And then that kind of peters out after a while. So it just kind of, you never put out the fire of the house. The house is still on fire. But you're putting in new curtains and you're decorating, so you're smoldering again. So you're never addressing the root cause, which we go into in our book. You'll really understand this more than most physicians will if you read our book. But going back, it's that you're never reaching any causal issues. You're never treating those. So your doctor may tell you to exercise and eat better and things like that. So that could absolutely help what's going on. But it's just, you just keep going and going in that model. It's kind of like, just a forever model. So Eric, go ahead and chime in.
So I think the issue comes down to doctors have been trained that, and maybe rightly so, that the only time that there's really a need for intervention when it comes to, well, you use hypothyroidism, but let's use hypothyroidism as our example, that the only time to really intervene is when the gland has become dysfunctional to a point where the person can't make their own thyroid hormone anymore. So how do we determine what that is? And that is when TSH is elevated and free T4 is lab low. And that's when they say, hey, the gland is not making enough thyroid hormone, we need to give it to you. And they've been trained, and people get frustrated. Why wouldn't they run a more comprehensive panel? And they've been taught that they don't need a more comprehensive panel to determine when the gland can't make enough T4 anymore. The gland makes primarily T4. And so if TSH is high, that usually means there's not enough T4 in the system. And if we run free T4 and there isn't much free T4 in the system, then the gland's not making it. So what do? We give T4. And they've been trained to believe that if you give enough T4 to restore TSH to the lab reference range, that you've restored what we call biochemical euthyroidism. You've normalized thyroid physiology throughout the whole body. And if all the cells, all the tissues regulated thyroid hormone the same, I guess we could say that would be the case. That might make sense. But the literature has shown over the last 30, 40 years that all the tissues have the ability to regulate thyroid hormone independently of each other, and to some degree independently of what's going on in the bloodstream, what's happening at the thyroid gland. And I think it's pretty evident we can oftentimes regulate thyroid hormone independently of the thyroid gland because we rip thyroid glands out or radiate them or do whatever to thyroid glands and put people on replacement therapy. And some people do well despite having no gland at all. But a lot of people don't do well just on thyroid medication, whether they have a gland or not. And so the allopathic model is not really focused on determining what happens beyond putting it in the bloodstream. They're just assuming that if we put the right amount of hormone in the bloodstream to replace what this damaged or diseased gland can't make, it's got to work. And the analogy I usually make is, if you have kids and you've sent your kid to the room and said, hey, I want you to clean your room, is it a possibility that you may go up there and your child didn't clean their room? Right? Is it possible? Absolutely. And you would say, well, it should have worked. I told them to do it. Well, welcome to parenting, because kids get to make the final decision. The same thing happens in our body. Just because we put T4 into the bloodstream doesn't mean that all the cells and tissues are going to use them appropriately. And so that's where we come in with functional medicine. If you have hypothyroid signs or symptoms, hyperthyroid signs and symptoms, then something is happening outside of the thyroid gland many times that's causing you to have those hypothyroid signs and symptoms or hyperthyroid signs and symptoms. And in each individual system and tissue has the ability to regulate its own metabolism. And what we talk about is that cells typically operate from one of two modes. What we call homeostatic regulation, where, hey, there's not much stress on the tissue. The primary focus of the cell or the tissue is to do manufacturing. I want to bring food energy in, and I want to make cellular energy, and I want to make hormones and membranes and neurotransmitters and proteins and peptides and all this awesome stuff I want to make. I'm in manufacturing mode. And to do that, what we need is a lot of T4 brought into the cell, T3 brought into the cell, and T3 to bind to receptors and turn on the manufacturing process. The other state we're often in is we could be in as a state of excessive cell stress. and the cells and tissues perceive some type of threat or danger from bacteria, from toxins, from these things, EMF and all of these other things that go on in the body, disrupted sleep, emotional stress, trauma, physical injury. We load all those things up over time, and that creates excessive cell stress. And cells say, whoa, I'm feeling threatened. I'm feeling danger. I need to shift my focus. I need to shift from manufacturing to cell defense. And the way a cell often does that is to reduce the amount of T3 inside the cell. So when we reduce T3 inside the cell, it turns off that manufacturing process, helps turn on the immune inflammatory cell defense process. And unfortunately, we don't feel good. Every time we get a virus, a bacteria, we're sick. I mean, this process is going on. But we can have that process going on despite a gland that works, despite appropriate levels of thyroid hormone in the bloodstream. And if, as an allopathic physician, I don't know what to do in that state. I don't know how to assess it. I don't know how to evaluate it. I don't know how to measure it. I don't know what to do. Even if you told me it was going on, if my one hammer that I have is to give you more T4 and your gland makes enough T4 and there's enough T4 in the blood, what am I doing with this hammer? I mean, what am I going to do? Give you more? Could that potentially create a problem? And the answer to that is absolutely. And physicians know this. It can cause, in a stressed condition, we typically get upregulation in the brain as a general kind of simplistic view. We upregulate the brain and downregulate the body as a general kind of simplified version. So if I give more thyroid hormone and I'm upregulating the brain, what does that cause? That causes more anxiousness, more anxiety, more upregulation of your sympathetic nervous system, more insomnia, more brain fog, more histamine response that's affecting the brain. Why would we want that? Why would I have insomnia in that situation? Well, because if you're in a threat mode, you're being chased by the proverbial tiger, you don't need to sleep, right? You're not going to take a deep sleep if you're being chased by a tiger, you're going to run. So you take a little cat naps, but you don't get deep, restful, restorative sleep. In that situation, what happens to the rest of the physiology? All the other stuff gets downregulated. I wonder why I can't get pregnant. Well, because if you're in excessive stress and you're being chased by the proverbial tiger, are you going to stop and have sex? Probably not, right? So do I need to put a lot of time and attention to sex hormones? Probably not. Are you going to stop and have a happy meal while you're getting chased by the tiger? Probably not, right? Probably shouldn't have one anyway. But what the body is not broken. What it's doing is it's shifting what its focus is based on what it's presented with. And I think it's completely missed. That piece of it is completely missed from an allopathic standpoint. We assume that everybody's in homeostasis when they come to us. They just have a gland that just shut down. They woke up one day, their immune system started destroying it and damaging it, but everything else works. And I just think that's craziness to think that you just woke up one day and your immune system forgot that your thyroid gland was your own tissue. To me, it doesn't make any sense at all. And I think Kelly agrees with me in that. And so that's where we should come in. And from a functional medicine standpoint, initially I was irritated with allopathic medicine. Kelly was in the model, was in it, then gets diagnosed, and now is frustrated by her own model and has to come this way. But even through our process of writing the book, we had to kind of change our temperament and get away from angry voice to that angry voice isn't going to be helpful either. And we need to build that bridge. And we also have to call out our own colleagues to some degree, because there's a problem there. And the part of the debacle is what we do in functional medicine when we look at a thyroid panel and say, hey, we're better physicians because we're not just looking at a TSH and free T4. We're looking at thyroid antibodies. We're looking at T3, reverse T3, free T3. We're looking at the whole panel. And because we're better, we see that they're not converting T4 to T3. So we're going to give them T3, and that's going to be better. Again, assuming that you woke up one day and forgot how to convert T4 to T3. And again, I think that's a bad precedent. And just like T4 can make somebody feel better initially, we see the same thing happen with T3. We need to ask better questions, just like when you're helping women with infertility. Sure, can we jack them on all kinds of hormones to try and force a pregnancy? Yeah, I think we've proven we can do that. Is that in the best interest of the potential child? Probably not. Is it the best interest of the mother? Probably not. Maybe we should ask the questions, what's going on with the physiology that they can't regulate their hormones naturally? I think that's the better question to ask.
Mm-hmm. I feel like, yeah, that's so interesting, the way that you describe everything, the way that you put it all together. So if I were to paraphrase for the listener, obviously there's more going on here. It sounds like what you're saying is that the allopathic model is basically like a math equation. They're like, oh, there's not enough T4 because your thyroid hormone isn't putting it out. So we're just going to add more, right? But what you're saying is there's more to it than that. There could be enough T4. And my understanding of T4 is that it's kind of like a pro-hormone or even like a storage hormone. So if I'm describing it in a way that doesn't resonate, you just, describe it a different way. But I'll share my understanding. My understanding is that it's kind of inert. That's how it's described in the research. And in order for us to get the thyroid hormone into our cells and actually feel good, a conversion process has to take place. And the T3 is a lot more active, and that's what actually gets into the cells and makes us to feel good. So am I good so far? I just want to well,
yeah,
I know you can give a whole bunch more. I'll just finish, like, because I guess what I'm getting at is what you're saying, from what it sounds like to me, is that it's not just that simple. There's all these other factors that are going to determine how well our body is going to be using these hormones. And if all you're doing is adding more, you're not actually addressing like the real underlying problem, which I believe what you were describing before is what you call cellular hypothyroidism. Am I somewhat there?
Absolutely. So the cell gets to determine, do I want to increase my metabolism? I'll bring more T4 in, convert it to T3, or do I want to slow my metabolism down? I'll take that T4, I'll deactivate it to something called reverse T3, take some of the T3, deactivate that to T2, and I slow the metabolism down. And it's not broken physiology, it's adaptive physiology. And I think that's the thing we have to consider. The cells have the ability to adapt based on what's going on. And so if we need to increase metabolism, we increase T4 to T3 conversion. T4 is primarily, as you said, is a circulating storage form of the hormone. It doesn't mean it doesn't do anything. It can do something. And that's why I'm really opposed to excessive thyroid hormone medication, whether it's T4 or T3 based. But it has the potential to have an effect. It can have an effect that maybe is not the most beneficial if it's excessive. So I think overall, we just need to ask the better question. Instead of playing whack-a-mole with lab values, let me just give this to even it out. We need to do a better job. Allopathic medicine's job is often to do crisis management. I've got high blood pressure. I need to lower it. I've got too little T4. I can give you some. But it doesn't mean that we fixed why it was that way. And that's really what we need to do, is ask the questions. If we want to get people healthy, if we don't want to have a large percentage of our female population being infertile and really struggling with pregnancies, we have to ask better questions. Why is this occurring? Why are more people hypothyroid than ever before? Why are more people obese than ever before? And we like simple, straightforward answers. This is low, I give that. That's high, I knock it down. The cellular physiology is way too much complex. I would much rather have people think about their cells like we think about people, right? And the analogy I typically use is, you now have 2 children, right? If you were having a big party this weekend and you were cooking and cleaning and doing washing, feeding your kids all at the same time, and somebody broke into your house and started attacking your kids, would you continue to cook? Right? Would you pack all the stuff up in nice glass Tupperware, or would you go protect your child? Would you slide a load of wash in, or would you go protect your child? Would you try and go vacuum, or would you protect your child? Would you go try and take a nap so you're rested up to go fight off the attacker, or would you immediately go take care of your child? I'm sure you would say, I would drop everything and go protect my child. But if I walked into your home in that moment and saw the food burning on the stove, the vacuum cleaner running in the middle of the floor, clothes all over the place, and the house is a disaster, I could say, well, I can easily see the problem here. Lisa is a terrible cook, terrible housekeeper. So I'm going to hire her a cook and a chef and a housekeeper, and voila, the place looks better and I fixed it. But did you really? Or did you just window dress it? And that's the point we're trying to make in the book and in most of the conversations we have. Window dressing may help somebody in the short run, but it doesn't really fix the underlying problem. Just like we could give somebody a bunch of estrogen and progesterone and load their buttocks up with hormones, and the blood values can look better, but that doesn't mean it works optimally in the tissue. And people are like, well, this infertility thing didn't work. I took all the hormones, it didn't work. Right, because just because you put something in doesn't mean the body is going to use it the way you want it to. The body does things from a protective response. So if your listeners, my listeners, the readers of our books, right, look at it like my cells aren't stupid. The body works in a way to protect, the cells work to protect themselves. The body typically works to protect itself and adapt. When we start having chronic health issues and with signs and symptoms, we need to ask, what is my body trying to protect me from versus why is my body broken? And that's a much better place to come from.
Oh, this is so interesting. What I feel like you just described is very much how I look at the menstrual cycle. So I feel like I'm getting it now, like more deeply in terms of the approach that you're taking. So even the analogy with giving more progesterone. So when you're looking at the menstrual cycle in a lot of depth, then you can see things like a short luteal phase or issues that would indicate low progesterone. And the easiest way to fix it and make the chart look pretty is to give women progesterone, which isn't necessarily a bad thing in many ways. I mean, it's not something that's really harsh. It's something that's tolerated really well. It's something that has really positive effects. It can lower the risk of miscarriage. It's actually not like this terrible thing. But the question I often ask to my clients in those cases is, well, why is the progesterone low and why aren't you making it? I believe your body is capable, like what you said, like it's not broken. So shouldn't we be looking at why we aren't making it? And often the types of support that I kind of work with clients, we can actually get them to be making the progesterone that they need and et cetera. And then instead of the supplemental progesterone being the primary, it can be like the maybe later. So the point I'm getting to is that it sounds like when we're seeing these issues with the thyroid, you're looking at it like, well, we're saying, okay, the thyroid isn't working, but maybe the thyroid is working. Maybe the problem is everything else that's going on in your body that's creating a whole disaster where your body can't really utilize the hormones that are already there. That's a really, really powerful way of looking at the thyroid, where instead of looking at it like your thyroid is broken, it sounds like you're looking at it like actually your body's working fine, but and the reason that you're having these symptoms is because your body's trying to cope with whatever you're putting it through. I don't know. Am I getting it now? I feel like that's where you're going with this.
Yeah, I mean, and Kelly, you jump in anytime you want, but I think that's exactly what we're talking about. The physiology in the beginning is often not broken, but adaptive. Now, if you leave a body adapting for an extended period of time, things are going to break down. Okay. And so I'm not opposed to any intervention somebody gives, right? If you need crisis care, you should get crisis care. If your goal is to raise your progesterone and you need it to make you feel better, that's great. Not everybody wants to try and address the root cause, but for people who aren't doing well in that model, we need to have that bridge where the allopathic physician says, hey, I've done what I can do for you from a drug standpoint. You're not responding the way I would expect, or you're not responding the way you would hope for, but this is the tool I have. And maybe there's another option here for you. And then become aware of what we do in functional medicine. And then we can have those referrals back and forth. Just like the person who comes in and says, hey, my menstrual cycles aren't appropriate. What can you do to help me? For you or for me, we may be looking at lifestyle issues, dietary changes, right? All these things. They're like, whoa. I don't want to change my diet, right? I'm not going to go to bed later or earlier, or I'm not going to exercise. I don't want to do any of that. Isn't there something you can just give me to regulate my hormones so I bleed on time? Don't you have something like that? Can you look in that file cabinet and tell me that? For the person who wants a simple pill management strategy, thank goodness there's allopathic medicine, right? But for the person who wants to get healthy, and we can have an argument all day about what that actually means, but for the person who wants to have a higher state of health, doesn't want to be dependent on drugs and managing conditions, they need two things. They need to know there's another option out there. It aligns really well with exercising, eating healthy, sleeping well, and lifestyle factors, and it doesn't require a lot of medications and oftentimes not a lot of supplementation on a consistent basis. And it's the best tool long-term, because if you're addressing the stressors and you're raising your overall health early on, you're going to be healthier longer. You're not going to need as much medication longer. And you're actually you're not managing a disease as it can get worse or a condition as it gets worse. You're preventing it. Isn't that what we're always say we're doing? We're doing preventative medicine. Are we? Or are we just doing disease management and managing it from an earlier state?
Well, so question, I feel like Kelly, you might be able to jump in on this because you mentioned this earlier to some degree, which is that, you would be seeing these patients and they would have all of the symptoms. They would look textbook like they are hypothyroid, but then their labs would be air quotes normal. And I feel like this is the story of my life and of the life of many people who work in this space where you're working with clients who have all of the symptoms, but their labs are coming back normal. And I feel like the way that you've both been talking about thyroid and how it's presenting and how you could have all the hormone, but your body isn't able to utilize it. I feel like for a lot of people, this could be the missing piece that's finally going to make sense of what's going on. Like, I don't feel good. I have all these symptoms. The doctor's telling me I'm fine because my labs are normal. Like, I feel like this actually provides a really good explanation as to why this could be happening. So I'd love for you to talk a little bit more about that.
Yeah, so I have a personal story about this. So I have an 18-year-old, a 16-year-old, and then a 7-year-old. And when I was in medical school, I had both of my kids. And then when I was post-medical school, I actually got really sick myself. And so I was diagnosed with multiple sclerosis. And my root cause, because I just went on to just not accept that, was Lyme and mold. And so throughout that journey, I got diagnosed with Hashimoto's thyroiditis. And I went outside the allopathic model, and it became a lifesaver for me to learn naturopathic medicine. I got a degree in it to learn from people like Dr. Eric. But at that point, about 5 years after I just really recovered, we decided we wanted to have another baby. And so I was like, okay, my body's doing great, but I had this diagnosis of Hashimoto's, and I was put on just a little bit of T4, and my labs were always coming back fine, but I just didn't feel good. I really just didn't feel the best. And I thought I was doing everything right, but come to find out, I had a deviated septum. I wasn't breathing at night. I basically had sleep apnea. I was exercising too hard, and I was on a vegan diet because I thought that was the way to really help myself, cleanse and all the stuff. But we could go into diet, but we won't go there today. So for me personally, I had these cellular stresses that were really impairing my body's ability to get pregnant, because we tried for about a year. It just wasn't happening. It wasn't an age thing, but when I corrected, I didn't add in more thyroid hormone. I didn't, anything like that. All I did was take off the cellular stress. What Dr. Eric talks about is that allostatic load. Your body doesn't want you to get pregnant if you're running from the tiger, just like he said, you're running from the tiger. So I started to look at the things I was doing, and our book, part 3, guys, is all about how you can take off all the allopathic load, the allostatic load. You can take all of that off, and you can get healthy in your own way. It's like your own personalized medicine playbook at the end of our book. So I made just some very easy, I started exercising less. I didn't do the HIIT training. I got my septum fixed and changed my diet. And really, I was pregnant within like 2 months. It was nothing that and I felt great. I really felt great. And so again, it's kind of like, I really love to be practical during any podcast that Eric and I do. And so the practicality is that everyone's different. There's stresses. Everyone has different stresses. Some people have a lot, like when I had Lyme and mold, there was no way I was getting pregnant. I mean, no way. It was hardly could get out of bed. But, when you start addressing your cellular stresses, just like Eric said with that analogy, I love that. If you're cooking and cleaning and you have kids in the room, your body's going to go do what it needs to do. And that takes your fertility to a backseat. That is a backseat, but that's okay. Because if you can identify what the cellular stress is, and you can start to modulate that, attenuate that stress, that can absolutely affect your menstrual cycle. It'll help, everything. It's everything that I do on a daily basis to help my fitness factors, what Dr. Eric and I call them, the dietary fitness, respiratory fitness, sleep fitness. There's how many other 9 fitness factors, Eric? So that when we do that, we are helping our health overall. We are on the path going in the right direction, right? We hope that those that are struggling with infertility, we hope that it corrects that, but nonetheless, you are on that health path for yourself and you're making your body healthier.
Just popping into today's episode to invite you to join my Fertility Awareness Mastery online self-study program. If you're looking for an informative and comprehensive DIY option for learning fertility awareness, I've got you covered. This program is the most comprehensive fertility awareness self-study program available. And the best part is you can learn at your own pace in your living room for a fraction of the cost of one of my live coaching programs. Head over to fertilityfriday.com/mastery for details. That's fertilityfriday.com/mastery. Now let's go ahead and jump back into today's episode. Well, and you've mentioned the term like cellular stress. And so I often like to kind of define stress and talk about it because I feel like we use the word stress all the time and we hear it, but we don't really realize what could be the stressors on the body itself that could be negatively affecting the overall thyroid function at the cellular level, for example. And so when you think of stress and you throw out that word, it's often like the boss yelling at you or this event, like an acute stressor. But obviously, in the context of this conversation, these cellular stressors are beyond that, beyond just you feeling stressed out. So maybe share with us some of those kind of common stressors or even less common, but some of the things that you've seen to have a really significant impact on overall thyroid health.
Sure. So we talk about physical, chemical, emotional, microbial stress. So, right, we kind of throw that word flippantly like stress, the kids whining, that's stressful, but really those 4 categories. So chemical stress, like clean up your products you're putting into your body, be careful with your plastics, filter your air, filter your water. And we go into detail in our book. Like you don't have to be the detective. We did this work for you. Emotional stress. I love this one. I think it gets underplayed that this can really shut down. It's a stress. It is a stress. And we're so much better about our mental health than we were even 5 years ago. But it can really physiologically affect you. And microbial stress, again, is there mold in your home? Do you have a latent infection like Epstein-Barr or, Lyme or something like that that's weighing you down? And then physical, chemical, emotional.
But these things, right? We talk about this environmental stress. We don't think that this can create stress, right? Well, it can, we kind of, now you see all the stuff it creates emotional stress because people are looking at it and they're thinking negatively about themselves, whatever.
And he's holding up a cell phone for those listening who don't know what he's referring to.
So we got this G thing going on, right? The frequency. This is supposed to be low frequency wavelengths that go through, and they're not supposed to be problematic. High frequency typically creates all the damage to our tissues, like X-ray and things like that. We say, oh, okay, I get that. Gamma rays, X-rays, they can be damaging. But all this low frequency stuff, phones can't create a problem. Well, they can, but people don't consider that this may be a potential problem because I don't feel anything when I'm around it, right? I don't smell anything, right?
Death by 1,000 paper cuts.
Right? So we don't think about it. But talking on the phone, right? This thing generates heat that can have a thermal effect directly on somebody's thyroid. But here's another key point that we don't think about: how these things, Wi-Fi that's going on in our home all the time, how these things can impact us. But there was a study that a mutual friend of Kelly and I, a woman named Kathy Vion, sent me. I had her on the podcast interview a couple days ago, and she sent me a paper ahead of time. And in that paper, they talk about how low frequency radiation, which is what our cell phone our Wi-Fi, all this stuff does, increases a hormone in the body called NPY. And NPY, what they found when that happens, it increases blood pressure, right? So it's increasing inflammation, causing vasoconstriction, increased blood pressure. But that's not it. It increases, I think the number was like a huge increase. I want to say 30, but I'm not sure it's 30 times, but it increases NPY dramatically. And when you increase NPY, it just doesn't increase the cardiovascular effect. It doesn't create just vasoconstriction by upregulating the sympathetic nervous system. NPY is an orexigenic hormone in the brain, meaning it tells us we are hungry, even though we aren't. Okay. So we do 5G all day. I got my Wi-Fi on all night. I'm on phones. I got all this stuff going on. And we don't think about how the environment impacts us, right? We just want our quick technology so we can get there. We want to be synced in. But things as simple as this could be disrupting your overall health and physiology. By itself, maybe, maybe not. But now take this and contribute it to, oh, it's causing me to overeat. I'm eating more carbs. And that's what the study said. Not only does it reduce your satiety, reduce your satiety, meaning you feel more hungry, but it results in an increased drive for more carbohydrates, which then we take in more carbohydrates. We've got this sympathetic nervous system, this kind of fight or flight system revved up. We get more inflammation that downregulates our thyroid physiology. Now our metabolism slowed down, but yet I'm eating more carbohydrates. I can't use it. I store those in the fat. Now I store it in the fat. My leptin goes up. Leptin then triggers more inflammation. And now I got this inflammation, this leptin, and the inflammation is now just regulating my sex hormones, right? Man, I'm going to get more estrogen. For females, I may get more testosterone, PCOS. You know what I mean? This stuff is all tied together. And I know I'm kind of racing all over the place, but when we're thinking about what's creating your cell stress, it's potentially everything. Does that mean stress is bad? No, it does not mean stress is bad on the tissues. When I exercise each day, I go to the gym and I work out, I'm stressing my muscle tissue, right? And I'm breaking that muscle tissue down, but then I allow for rest, recovery, and that muscle tissue is bigger and stronger. We're constantly stressing tissue, which isn't bad. There's what we call a hormetic effect. If you don't stress a tissue at all, it doesn't get stronger, it doesn't get more vital. But we also have to allow for recovery. We don't do that very often in today's world, which is we just keep putting more stress, more stress, more stress, and we have no recovery. And eventually we start to break down. One of the things I hear a lot, and maybe you guys do as well, oh, they're so unhealthy, I feel terrible, whatever. They go on vacation, sometimes away from their spouse and away from their kids, or maybe they're out with their girlfriends, and they go away. Oh my God, I feel so much better. And you know what? I drank alcohol and I ate a bunch of food I shouldn't have eaten, but I felt so good. I slept so good. I felt so good. And you're like, maybe the reason is by leaving home, leaving kids, leaving an environment that's maybe toxic, unplugging, not being around a lot of emotion, a lot of things that are creating stress, you reduced the load, gave your immune system and your fight or flight system a chance to calm down. And all of a sudden you go, man, maybe this vacation thing is a good thing. Maybe I should be on vacation all the time. No, but it gives us the idea that physical stress, chemical stress, emotional stress, microbial stress, toxins, poor breathing, whatever, trauma, all these things are part of a load. And if we're going to be healthy, we're going to have optimal fertility and thyroid physiology and blood sugar regulation, we can't eliminate stress, but we have to create space for rest and recovery.
So I have a question. This made me think about something, and I'll do my best to phrase it. So one of the things that I've seen here and there in client work, and I don't always have the best explanation for it, but I feel like it makes sense, like common sense. If I have a client who's trying to conceive and she's had a long history of exercise, like a lot of exercise, years of consistent exercise. So not even necessarily that she's exercising an outrageous amount every week, but I'll just give an example. Let's say you have someone who's exercising and they're doing something very consistently. They're doing whatever they're doing and they're doing it for like 3 to 4 times a week. And they've been doing it for like 3 years. I've just found that when I'm working with clients who have that kind of history of such consistent exercise, even though they themselves would say, well, it's not that much, right? Because it's not every day or whatever, but they literally haven't taken a break for years. I don't know. I've just seen it take longer for them to see the results that they're looking for if they're not willing to take a break from that exercise. I don't know if what I'm saying is making sense to you, but do you have a comment on that? Like, because you mentioned something about like doing something over and over again and how that can cause stress in the body. And
well, I'm biased, I guess, because I think daily regular exercise is critically important to overall health and well-being. And I think if we had one thing that we could do on a regular basis that would help us overall across the board, sleep, blood sugar regulation, thyroid physiology, gut physiology, it would be physical activity and exercise. Is it possible that doing the same training, that do physical training, we'll just say it that way, working out or physical training every day could be unhealthy? It would all depend on everything else that's going on, and the extent and excess of what you're doing would be my opinion. Okay. But
I was thinking of Dr. Kelly's example as well, where she said that she was doing HIIT and she was doing a lot of it. And then she ended up having to kind of like change up what she was doing, or whether it was change it up or do a little bit less. So I guess the example that I'm thinking of is when it's like, because I do think there's a point where it can be too much. So obviously exercise is really good for us, but I'm just kind of curious if you've ever seen anything like that. Well,
let's look at it real simply this way, right? So let's say you're a person who wants to run every day, right? And you're going to be a half marathon or a marathoner. And so you're going to run, and you run every day, and you don't think it's excessive because I'm a marathon runner. I run, 5, 6, 8 miles a day. 20 miles a day. That's not excessive. I run 26 for a race, right? So you may not think it's excessive. But if you're running at a heart rate that is no longer aerobic for extended periods, for an hour, hour and a half, is that potentially, even though it doesn't feel stressful, is that potentially stressful on your cardiovascular physiology and on your overall inflammatory load? Could it create problems? The answer is absolutely yes. Because what happens, we are designed to do a lot of our activity for longer bouts of time, really as an aerobic being. We're using a lot of oxygen, we can burn a lot of fat, we can go long distance. In quick bursts of energy, we're typically using glucose. We can go through that really fast and real quickly and make it really quick. But when we're doing things that we think are really healthy for us, like running, but we're running anaerobically, that puts a lot of stress on the system to constantly keep generating glucose really quickly. So we upregulate cortisol, we upregulate epinephrine, because we do have a hormone called glucagon that does most of the kind of regulation of our glucose. But if you're really demanding the tissue, now you've got chronic cortisol upregulation, regular, maybe some upregulation of epinephrine, these fight or flight hormones that have to generate that glucose quickly. And that's taxing on the system. Could that create a problem? Absolutely. I've seen it. I've done it to myself when I had my own case of Hashimoto's with doing a lot of training for triathlons, lots of training, little bit of sleep. Could I say it was just the training? Probably not, but poor breathing, right? Deviated septum, poor breathing, lots of training, limited sleep for about 4 hours a night because sleep's for the week. And then you do all those things, plus being a dad, plus working, plus coaching, plus it all contributes to the factors. But you'll see a lot of athletes, especially endurance athletes, that you think are healthy because they can run a half marathon or ultra marathon, and they've got a nice little muffin top, right? Which you would think, why do they have a muffin top if they're doing all this exercise? And it's because they're probably training inappropriately. And you'll see people who are doing weight training and CrossFit and all these other things that they look like Greek gods, but their overall health and physiology is in terrible shape because they're overtraining and under recovering. And so while I'm a big exercise fan, I think especially as we get older, we need more time for rest, recovery, so that our tissues get a chance to go, okay, you challenged me, I got it, give me some time here and I'll get it all hooked up and get back together, and then we can go do it again. But a lot of times people who are very driven, especially when it comes to athletics and fitness, they think more is better and harder is better. I think a lot of people are starting to come to the realization that more is not always better, harder is not always better, but doing training appropriately and allowing for rest and recovery is a much better strategy for overall health and well-being.
And I'll just add to that is that we like objective data. So some people are like, how do I know I pushed it? I wear an Oura ring, for example, that will collect the HRV. So I can know if I pushed it too much because my HRV might drop. So it gives me some feedback that's not just
HRV is,
heart rate variability.
Yep.
So it's just, for me, just really simply, it's just a measure of how are you doing? Like, how's your body doing in general? I mean, there's an algorithm of how they calculate it, but you can use a device, and there's a lot of them. We don't have any affiliation with any of them, but you can use it to get objective data. Again, like my ring gives me a score. And so, I went and exercised when I got back from vacation, and my HRV dropped after I exercised. And I thought, my body's telling me I pushed it too hard. I wasn't ready to do that. And that's not good for me, right? So that was a stress, that was overdoing it. So now I'm just doing light walking and things again until my HRV recovers. So that's a really, really great tool, I think, for anyone to just measure the state of their physiology.
Mm-hmm. That's so helpful. I feel like when you were talking, I think for Eric, when you were talking about just kind of the process, the word that kept coming to my mind was burnout, because it's a real thing, although sometimes hard to like quantify, like at what point exactly am I hitting the burnout? But I feel like that was really helpful to provide some context there, because it's something that you see. I'm sure you've seen it. It sounds like you've both experienced it. I've experienced it, where maybe you just push things a little too far for a little too long. And I think you made a really great point. Also, it's not just the one thing. It's not just exercise, but it might be the exercise plus the not sleeping, plus the not taking enough time to recover, plus the whatever else is going on. So I feel like it really does kind of round out the conversation there. And Kelly, I love the kind of objective data piece of it. And of course, I would add, because I'm the menstrual nerd over here, the menstrual cycle is the vital sign piece. That's typically that main sign that I'm using with my clients, where I can see in the cycle if you've got signs of low hormones, if we're kind of pushing it too far, if we've got whatever that looks like, whether it's like low mucus or luteal phase issues or whatever, you can see it. And so in a similar way of the Aura Ring, kind of telling you like, wait a minute, I need to kind of give myself a little bit of a break here. There's also other signs we can look to for that. So I think that's really helpful. And as we kind of start wrapping up today, I would love to leave the listeners with I feel like we've touched on a ton of things. I feel like we're getting the point, but maybe summarize for us then some of those key things for us to focus on to support thyroid health. And I feel like a lot of our listeners might have tuned into this episode specifically because we talked about thyroid, and they may have listened to tons of other podcasts about thyroid that are saying different things, that are not necessarily focused on the cellular aspect of it, that are more focused on whether it's supplements or taking this type of hormone versus this type of hormone and things like that. I feel like your approach is different. So what's a good place to start for the listener who's kind of like, this is really interesting. Like, I just never thought of it this way.
I guess I'll start, Kelly. So I think for the listener, if you think you have a potential hypothyroid condition, I really don't care what condition you think you might have. If you're not where you think you should be, there's foundational principles that you need to start with. We call them kind of low-hanging fruit. You should focus on a healthy whole food diet. I know there's lots of the food wars are out there. We circle the wagons. We're shooting in at each other. Vegan's awful, but it's better than carnivore. Carnivore is terrible, but keto's better. Like, look, end all the nonsense. Eat whole food 80 to 90% of the time, and you're probably going to be pretty healthy. Cut down your processed foods. Start there. If you're eating a processed food diet, the vast majority of the time, you're going to be unhealthy. It's not when, you will be. And so any condition is going to get get better if you do that. If you're not doing some level of physical activity every day, you should do some. Does it have to be aggressive? It does not. It could be as simple as going for a walk and starting there. Keep your mouth shut, go for a walk, and breathe through your nose. Really pretty simple stuff, right? Once you get pretty comfortable with that, then some basic strength training type exercises can be great. Push-ups, squats, lunges, don't even need a weight. And the easiest thing I tell most people to do, because everybody says I don't have time, is set your watch for 30 minutes, and every time the watch goes off, you do 5 push-ups or 5 squats or 5 lunges or whatever. And if you do go through the day and you're up 16 hours and you do that, let's say today's squat day, you're going to make a commitment that I'm going to do 5 squats every 30 minutes, and you miss half of those times, you've still done 5 times 8, right? Which is 40 squats that day, right? So you've made some improvement. So do something physical every day, some strength training, some slow cardio, do some yoga, Pilates, stability and flexibility training, rotate it through the week, but get in the habit of protecting 30 minutes of your day where it's just for you to do something to improve your physical well-being. You've got to work on your emotional state. It's probably your emotional fitness is probably one of the biggest factors that plays a role in having negative consequences on our health, because we start to think things between our 6 inches of our ears, and those things over time become reality. And so everybody poo-poos it. I don't want to sit in the middle of the floor and hum and have smoky stuff going up behind me. You don't need to do all that stuff, but you have to watch your stinking thinking. And we talk to ourselves more than we talk to anybody else. And so you really need to be careful what I'm saying to yourself on a regular basis. I'm fat, I'm fat, I'm fat. Guess what? If you're fat and you keep telling yourself you're fat, you're probably going to live up to being fat. Okay. If you say, I'm stressed out, guess what? You're going to produce hormones that are going to cause you to be more stressed, because you are going to manifest into your life whatever you spend a lot of time thinking about. Right. So I can't get pregnant. I can't get pregnant. I can't get pregnant. Guess what? You're probably not going to get pregnant. So watch your emotional fitness. Kelly and I talk about that in the book. It's super important. Sleep. You need to protect sleep. Sleep is critical. You recover when you sleep. And if you don't sleep well, guess what helps sleep? Physical exercise and activity. When you do physical activity and exercise, you increase the hormone, which is called your sleep hormone. It's called adenosine. It's not melatonin. It's called adenosine. And when you increase the level of adenosine as you're more active through the day, that tells your brain it's time to stay asleep so you can rebuild that adenosine back into something called ATP, adenosine triphosphate. That's your energy molecule. So if you want to sleep better, you exercise every day. If you want to be able to exercise every day, protect your sleep patterns. And then breathing, we talked about that. You got to breathe through your nose, not your mouth. Nobody wants to tape their mouth shut at night, but it is one of the best things you can do, is start to learn how to retrain your body, how to breathe through your nose. It does so much good to help you. And so those are just some of the strategies Kelly already kind of alluded to. Reduce your environmental load. Use more clean products, whether it's deodorant, hair lotion, the clothes you wear. I think everybody's on the kick that one brand of sportswear has all these endocrine disrupting chemicals in them. But your environment, your house, your cleaning products, the clothes you put on, the products you put on your skin, try and use the least toxic version of those things. I think those do the low-hanging things. I'm sure I missed something, and Kelly will correct me if I missed something.
Because I work for a hydration company, I think I need to plug water. I mean, literally. So I work for WEO, just full disclosure, but we augment water, giving it more properties than hydration. But if you just focus on just getting good, clean water in, it's how we get our toxins out. It's how our skin looks better. I mean, you get so much return on your investment for just drinking enough water. There's an excellent podcast from Dr. Huberman all about hydration, if you want to get really deep in there, but especially when you're trying to get pregnant, like hydrate, right?
Mm-hmm. And so all of those things sound amazing. So the question then for someone who's listening, that's like, I think when we hear a lot of these lifestyle pieces, I feel like it kind of goes into the back. Like you can kind of feel people's eyes glazing over, like telling me all I need to do is sleep better. And like I've heard all this before, right? And obviously there's a difference between hearing about it and actually doing it. Some of these things are the hardest things. It's changing our habits are the hardest things to do.
Amen. So
for the listener who's kind of like, yeah. What do you, not that I'm saying you are a listener, but I'm just putting it out there hypothetically. What have you seen in terms of improvements? That's, I guess, the question, right? Because from a lot of the information out there about thyroid, it's like, well, you're not going to get better until you take this hormone or take that hormone. And I'm sure there's a place for that. I have an issue with my thyroid that has been consistent for many years as well. And so when you do these things from whether it's both personal but professional experience with clients, how effective is it? Are we seeing people get off medication? Are we seeing people improve? Are we seeing symptoms go away? What are we seeing? Just you can kind of take that wherever you want. But I'm just, for the skeptical person, it's like, that's all I got to do.
Yeah. So because I'm still seeing patients in practice, I'll take this and then Kelly can jump on. But people come to see me because I talk through this lens of thyroid physiology. We wrote a book, I got a podcast, and they say, okay, what are you going to give me to fix my thyroid? And I usually tell them absolutely nothing. You don't need probably need another supplement to help conversion. You probably don't need the vast majority of the medication you're taking. What we need to do is be systematic. And this doesn't sound sexy, but what I do when we assess labs, right? And we have to interpret labs, not read labs. That's a totally different thing, which is why people go to the doctor and they say, your labs are normal, because they didn't interpret them. They just read them like a monkey would read it for an H or an L. And that's not interpreting labs. Okay. So that's an issue. But what I do with all my clients, and I've been doing this 30 years, I know I look really good for doing this 30 years. But the issue is, it's really what we talk about in the book is what I do day in, day out with clients. I look at their overall blood panel. I say, listen, you do have cellular or tissue hypothyroidism going on. It's because there's inflammation in the body. It looks like some of that inflammation is coming from your GI tract. So we're going to maybe take a look at your GI tract, and we're going to have you fill out this. It looks like multiple systems are struggling and compromised. So we may have to address all these systems. And I'm going to give you a number of questionnaires to check out. I have what we call a fitness factor questionnaire. So I look at their environmental fitness, their physical fitness, their emotional fitness. And then when they fill that out, and I go, okay, here's the systems that are the most compromised. And these are the ones we're going to start to try and raise their level of fitness up. What's our sleeping habit? How can we change it? What can we do to support it? Right. And I walk them through each one of those scenarios. It is so rare that I ever recommend anybody go on thyroid medication. Matter of fact, the vast majority of people are over-medicated when they get to me. Some people are over-medicated on T4. Some people are over-medicated with Armor or things like that. And other people are over-medicated on T3 supplementation. So what I'm usually trying to do as I'm working with these clients is I am trying to get them to reduce the thyroid medication dose through whoever's prescribing it while I work on these things. And not only do they feel better, but this isn't a one-time strategy. I'm looking at their thyroid panels probably every 30 to 60 days. And we're often, every time we're doing that, we're reducing the dose. So I have many, many, many patients. I would say almost every patient I see who comes to me on thyroid medication has to reduce their dose in time. And I've got a ton of patients who we've had to eliminate their thyroid medication altogether. If you give me 1 second, I'll give you a perfect example. I have a patient, I've seen her for on and off for a long period of time. She's got a couple other doctors that she works with. Is usually not my thing, but I hang in there. Every time I see her, she's taking a different steroid or changed her thyroid medication or something else. And we just had a kind of a moment where I was kind of said, listen, I don't even know what to do for you. You're taking so much stuff that I don't think you need. My suggestion is you stop everything, and let's rerun your panels. And then I can give you an idea of what to do. So off for testosterone, off the hormone replacement, off the thyroid hormone, T4 and T3. And guess what happened when we reran her labs? Her hormones are better. Her thyroid panel is normal. Her cholesterol levels back in normal range. Blood glucose regulation improved. She was, not her per se, but her physician was, and her physician were trying to manipulate values with medication, which at one point may have been justified. But they kept, what you wind up doing is chasing the problem and keeping trying to fix it. You're not realizing that the thing you're using to try and fix a number is actually creating another problem. So by taking a sex hormone, by a hormone replacement therapy, it was altering thyroid physiology, which then they took a thyroid hormone, which then altered something else, right? So in most of the cases of my clients, that's what I'm trying to do for them is say, hey, I really don't care what type of thyroid hormone you take at the end of the day if it makes you feel good. But what we do want to do is we want to reduce the stressors, improve your level of fitness in all these categories so that the medication you take works better and you need the least amount possible. That's what I've been doing over 30 years. And it's a consistent strategy that works for our clients. What's the secret sauce? Do I have some special supplement that converts T4 to T3 better? No, I don't think that stuff always works out. I don't think there's a secret thing that everybody who has low T4 to T3 conversion needs to be on. Like everybody needs selenium, everybody needs this. No, I don't think that's the case. I think they're great for sales. They're great to sell supplements. It's all that stuff, but it's not realistic. It doesn't sound sexy, but if you want to improve your health and well-being, you get a coach like you, like me, like Kelly, who says, let me look at this objectively. Let me tell you where you think you're doing well, but you're not. And let me give you the tools and strategies to help improve your level of health or fitness in each of these categories. And then we can use supplements supplementally to help return some of those systems back to health, and then use supplements as a strategy, but not as the only thing that we do. We use them periodically, strategically, higher times of stress to help somebody maintain a higher state of health, but not be the tool that manages their disorder, just like we don't want them using drugs to manage a disorder.
Well, I feel like... Oh, no, go ahead. Sorry.
I would add that if you are a practitioner, that we have actually recorded an entire practitioner course. So if you'd like to learn our method and become like a thyroid debacle specialist, and that we're planning on also doing a layperson's course as well. So if you can't find anyone like Eric or yourself, and you want to learn more, we're going to be doing that hopefully in 2023.
Mm-hmm. Well, this has been such a great conversation. I feel like my clients in the FAM program, my practitioners, would be kind of smiling at this point because we are speaking the same language. I feel like there's a lot of similarities there. And what I always find interesting is that you get a lot of results when you look at what's actually going on, when you're looking at the actual real-time data and what actually causes that needle to move. And you're right, it's not sexy. It's often not what people want to hear. But these types of strategies are what really do it. It really does work. And I love what you said about having then the supplements actually be like, once we've gotten you 80% there, 90% there, then we use these other strategies to kind of round it all off. But that's not where we're going first, because that's not how you actually get the best results. So definitely resonating with your approach. I just want to thank you so much for coming to the show. Please let us know more about each of you individually. Tell us about the Thyroid Debacle book, where we can go to get it, the socials, mention again your course, all the places, all the things.
So my practice is Rejuvigen. RejuvigenCenter.com is where you find my website. If somebody's got an interest in potentially speaking with me or potentially working with me, they can go there and schedule a complimentary discovery call, or we can kind of have a quick chat, make sure we're on the same page before they spend money to schedule a consultation. If you want to hear more discussion, more deeper discussion about health and thyroid physiology, I have the Thyroid Answers podcast, which you've been on, and we talk about all aspects of health, not just thyroid physiology, but we talk through the lens of cell danger response. We've got the book out there called The Thyroid Debacle. It is available Amazon and Barnes & Nobles, wherever you get your books. We do have the Thyroid Debacle course. So I think I'll send you the link for the Thyroid Debacle. I think it is the Thyroid Debacle course, but I'll double check that. I should know that off the top of my head, but I don't. And then I guess most of my posting is on Instagram, maybe Facebook, but I think that's where I just kind of put little snippets of information, short videos, and then I do what I call my Thyroid Thursday videos, where I do a little longer form explanation of different aspects of health and thyroid physiology.
So I don't see clients anymore, unfortunately. I may come back off the bench here to come see some people. I get a lot of people who need help, so maybe I'll come back. But for right now, I'm a chief medical officer for a biotech company and just loving what I'm doing. Like I said, I'm obsessed with hydration. You can find me on social media at Dr. K. Halderman, but I'm still posting on things. I'm still active. Of course, if there's any questions or anything like that, just hit me up there.
Awesome. Well, thank you so much for being here. This episode has been really informative. And like I said, I really like the approach that you share with thyroid, because it is different, as you know, I'm sure, to what we often hear. It was kind of like the first things to do. So really appreciate that.
Thanks for having us on.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/474. I hope that you enjoyed today's episode. It's always fun to have two guests on the podcast to get two different perspectives. And I really enjoyed today's conversation about thyroid health, and just to kind of give a different perspective. Like I said at the top of the episode, it's really interesting to look at the incredible impact that changing your lifestyle factors, diet, improving nutrition, addressing micronutrient deficiencies, it's really incredible to see what a significant impact that can make on thyroid function. And really interesting to hear Dr. Eric and Dr. Halderman's take on it, really, especially with Dr. Halderman coming from a medical background as an MD and really kind of re-examining how she was treating her patients. There are plenty of other really informative episodes on the podcast related to thyroid specifically. And if you're looking for those details, we will link in the show notes page to previous episodes that you can refer to. And you can also head over to fertilityfriday.com/thyroid, and you'll be directed to our thyroid episodes that we've had over the years. So lots of great resources for you there. And I hope you have a wonderful weekend, whenever you're tuning into the show. And of course, as always, until next time, be well and happy charting.